Hey gang, Mark Sweeney here from Austin Dental Spa in beautiful, wet, rainy Austin, Texas. There's a tropical storm, the first one of the season, hitting the coast down near Galveston, Corpus Christi, and we got some rain from that. We're supposed to get some rain tomorrow. So instead of being a sauna, it is a spa now. So we got a steam room going for the next 2 days. So anyway, that's what's going on here in Austin, Texas. If you've tuned in before, you know what this is all about. This is Wisdom Wednesday, every Wednesday about this time. I get online. Sometimes my K-team joins me, my other two doctors, and we try to give you something that'll be useful information that you can take back and put it to work in your own lifestyle and make a difference, a positive difference. We also like to have a little fun sometimes. Today we're going to be talking about a very fun topic and one that's near and dear to my heart. Did you know that there are over 700 bacterial species in your mouth, bacteria and funguses, living in that little area right there that help you digest your food? They have a good and bad effects on your health. And we're going to talk about that today. But first, I got a little homework to do. As you know from last week, the voting is ongoing right now. Every day you can log in and vote for the Community Choice Awards. Our local newspaper, the Austin American Statesman, sponsors it every year. We've won at least one or both of the categories every year for 7 years. Best cosmetic dentist and best dentist. And 3 years we've won both. So we depend on you and we appreciate your support to go online every day and vote. The voting ends next Monday, I believe. So we've got several days left. Your vote will count. If you log on once, then they'll send you an email, and it makes it much easier to log on each successive day. All you got to do is keep that email in one of your easy to access files in your inbox and click on it, and you go right to the voting from that point. The first time around, it's kind of a pain. You got to put your email in and you've got to verify that you are who you say you are. But we sure appreciate those of you who have already texted me. I've run into people out and around that said, I'm voting for you every day. So we appreciate it, because mobilizing the masses is how we win such prestigious awards. So thank you, those of you who are voting, and we would appreciate those of you who have not tried it to log on and vote. And so now let's get to those. And our theme for the month is Shoot for the Moon in June. So we try to do goofy little rhymes like that. And, we've also said each week that, hey, if you shoot for the moon and miss, you're still among the stars. So that's kind of our theme for the month. And this subject matter today is no different than shooting for the moon. As far as your health is concerned, we want you to be as healthy as you can possibly be. So how do we take those 700 plus species of they're not all bacteria, some of them are funguses, but it sounds kind of icky to think about it, but there are millions of bacteria running through your entire intestinal tract from this end to the other end, and they, for the most part, help you digest your food. They help the saliva be somewhat antibacterial by helping break down some of the toxic substances in your mouth and the food particles that are connected. So let's talk about 4 different ways that you end up with bacterial problems in your mouth. Well, first of all, and what we deal with all day long, is people who just aren't doing their work at home. They have poor oral health habits. They're not flossing, brushing. Believe it or not, we still see people in 2024 who don't even brush once a day. They'll come to the dentist and get their teeth cleaned, but they say, I just forget. Blows my mind. But they're out there. More and more these days, we're seeing people with weakened immune systems, either from going through health issues in another part of their body, that they're taking medications that have weakened their immune system, or they're going through a tough time health-wise, and or in some cases they're on some medications that knock out their immune system, trying to help some other area. Your genetics always plays a part in it. You can't change what your DNA says, and some people are just more prone to some diseases than others. Dry mouth. There are a lot of medications out there these days that can cause your mouth to be drier than it normally was or would be. And that dry mouth increases the stickiness factor in your mouth, so that food particles and bacteria, the bad bacteria, are going to stick to your teeth and stay there more tenaciously than they would have in the past. And so you've really got to get at them with an electric toothbrush or water pick or something of that sort, or come see a professional dental office to get it cleaned off properly. Lastly, antibiotics. We see a lot of that these days, that somebody was rocking along doing just fine, and then for something else going on in their mouth, cold, flu, intestinal issues, they end up taking a week's worth of antibiotics, and it upsets the apple cart. It knocks out some of the good bacteria as well as the bad bacteria, and it knocks things out of balance, and it takes a while for people to get back into balance. Their gums will bleed for mysterious reasons. They have diarrhea and other gastrointestinal upsets. So let's talk about 4 ways that probiotics and prebiotics, we're going to talk about prebiotics, can help, and how you can help keep that balance in your intestinal tract and your mouth, how you can keep it restored to a healthy level. Well, like I said earlier, oral probiotics are usually capsules, sometimes tablets, but usually capsules, and they actually have, as icky as it sounds, they've got bacteria in them that have been like freeze-dried or something. I don't know exactly the process they use, but they're the good bacteria. And so it's an easy one. You swallow the pill, it gets digested in your small intestine, and it releases more of the good bacteria so that they can proliferate there and either restore the balance or knock the bad guys down a notch so that they're in control. In the mouth, there's Lactobacillus salivarius, which is one that shows up in your saliva, and it is actually one of the good bacteria that gives off a peptide that breaks down the sticky stuff that builds up on your teeth, the plaque, and it helps break down food particles. And there's another one that Lactobacillus reuteri, that is also in the mouth, in a healthy mouth, that has to do with anti-inflammatory system. So if you have gum disease, your gums get inflamed, and this helps keep that neutralized. Oral probiotics also strengthen your oral immunity because of what I was talking about, creating that balance in the bacteria in your mouth. And finally, some of the oral probiotics will release peptides that, again, break down the icky stuff, the sticky stuff that's building up on your teeth. So we've talked about probiotics. Now we're going to talk about prebiotics. This was new to me until last fall. I was actually at a dental meeting, and a young woman got up to speak. Wasn't a dentist, so that's first clue that, hey, we're in for something different, because she didn't have DDS behind her name. She had PhD. Her name is Emily Stein, S-T-E-I-N. She's a PhD in microbiology from Stanford University, and she was peddling this right here, daily dental care. You can tell it's a PhD because she needed a marketing person to come up with a fancier name, but she was stimulated by her grandmother, who she was very close to, and at a late stage of her life, in her 80s or 90s, her grandmother ended up getting severe periodontal disease, and the dentists all recommended that she have all the rest of her teeth extracted, which was very traumatic for a woman knocking 90 years old. And so Emily wanted to do something to commemorate and try to keep other people from going through what her grandmother had to do. So she started studying oral bacteria. That was her field, but she had not ever thought like a dentist. And she poured herself into for several years, and she came up with a prebiotic. These are little white capsules. I bought them after that meeting, and I try to remember to put one in my mouth. They just dissolve in your mouth. They're little white capsules like that. They taste like mint flavored. I think they've got a second flavor out now. It takes about 3 minutes for them to dissolve. And what I do is, as it's dissolving, I paint them around my teeth. I paint the liquid around my teeth, and kind of like a paintbrush. And what this does is the same thing as a probiotic inside your intestinal system. These are the good bacteria that belong in the mouth. And so they neutralize the bad bacteria and they help proliferate in the good bacteria. If you do this every day for a couple of days before you eat, like 10, 15 minutes before you eat a meal, and you do that, after about 2 or 3 days, my mouth started feeling different. It felt different and it tasted different. So there's something to this. You can get it online. I buy it on Amazon now. Daily Dental Care. If you Google that, it'll pop up with a whole history or biography of Emily Stein. She's speaking at dental meetings all over the country right now because she's on to something here, that something as simple I've heard for my whole 45-year career. Can't y'all just come up with a pill that I can take that will keep me from having all these dental problems? Well, we've got it now. Try it out. They're not expensive at all. It's like $30 for 3 bottles of this, and if I remember right, but it doesn't matter. Even if it was $100 for 3 bottles, it's worth it if it can reverse some of the things that are going on in your mouth, neutralize some of the acidity, and make your gums and your teeth healthier and your teeth less likely to decay. It doesn't get any simpler than that. So that's what they're calling a prebiotic now, because it changes the balance in your favor without you having to even do anything as difficult as picking up a toothbrush. So my health tip for the week. Last week we talked about the Queen song being the #1 song as voted by scientists who studied music, and said one of the Queen songs was the #1 song to get mood elevation, to make you feel better about things. So we're going to expand on that theme and say, put on your favorite song, no matter whether it's the Queen song or not. Put on your favorite song while you're brushing your teeth in the morning and at night. And, you know, while you're brushing, get to moving a little bit. You're already moving your hand. And so my suggestion is, your health tip for the week is try dancing a little bit while you're doing your routine oral dental care. It's a little harder to do with dental floss, but once you get the floss between your teeth, I could see that you could, you know, sling it back and forth a little bit like people used to do with their towels in the 60s and 70s. So that's my health tip for the week. Make it fun. And I'll see you next week for another episode of Wisdom Wednesday.